Hello, my name is Dr. Carlo Oger. I'm a board-certified emergency physician and I produce patient education videos which can be found at PatientEducation.Video. In this video, we're going to be talking about acute bronchitis. Now, if you've been diagnosed with acute bronchitis and you have symptoms in the following categories like you faint, you pass out, your lips or fingernails are turning blue, if you feel like you're not getting enough air when you breathe, or if you have swelling around your lips, tongue, throat that makes it hard to breathe or to swallow, then you need emergency care. I recommend you stop the video and you go ahead and call 911. Now, let's talk about acute bronchitis. Acute bronchitis is also called the chest cold. It is an inflammation or swelling of the large airways or bronchial tubes inside your lungs. Coughing results from this inflammation and irritation of the inner lining of these large airways. Also, the glands in your airway produce too much mucus. Mucus is that slimy, thick fluid that moistens but also protects many passages in your body. But when you're sick, it makes too much of it or thicker, and then it's harder to deal with it. It produces the cough. The inflammation and mucus cause your airways to get narrow, resulting in the noisy, wheezy breathing that's characteristic of acute bronchitis. Complete recovery usually occurs within 10 to 14 days, but the cough might last longer. Smokers have slower recovery time, so if you do smoke, please stop smoking, or at least decrease it while you're sick. Acute bronchitis can sometimes lead to more serious cases of pneumonia. Sometimes we call it bronchopneumonia or pneumonia. That of course depends on the severity of the findings and of course x-ray findings once we finally evaluate you. Repeated attacks of acute bronchitis may mean the presence of long-standing bronchitis, asthma, or other lung diseases. What causes acute bronchitis? It is most often the consequence of a viral infection, most likely after a cold or flu symptoms. Other causes do include bacteria, but also irritation of the large airways by chemicals and fumes, dust, even pollen. People with underlying lung diseases like cystic fibrosis, chronic bronchitis, and asthma are more likely to get acute bronchitis. What are the symptoms of acute bronchitis? Well, much like the regular cold, you get runny nose, sore throat, fever, headache, aches and pains, cough with or without mucus, shortness of breath, and noisy breathing, wheezing. And of course, chest pain with breathing and or coughing. How is the diagnosis made? Well, a good history and physical exam is essential. Usually on auscultation of the lungs, the medical provider will hear wheezing, which is produced by the air traveling through the narrowed, mucousy, tight airways. The patient may have noisy breathing and an increased respiratory rate. For long-term or severe symptoms, the medical provider may order a chest x-ray to exclude the more serious infections or complications like pneumonia. How is acute bronchitis treated? Well, antipyretic medications are used to reduce both temperature of the patient who is experiencing fever, but also to ease the discomfort and body aches associated with the illness. Cough syrups that you buy over the counter might or might not work. In my experience, you generally require prescription level medications for the cough itself. Decongestants, especially those with Mucinex, can help with the mucus and the cold symptoms. Bronchodilators are the main therapy. Albuterol, ProAir, and Ventolin, used either via inhalers or by nebulizers, is the main way to treat acute bronchitis. It causes bronchodilation, therefore opening up the airway. Most patients with acute bronchitis will not need antibiotics, but if there is heavy mucus production, the patient's older, the patient's a smoker, or they have underlying lung conditions like COPD, then the medical provider will probably consider using antibiotics. Now let's talk on how to use the inhaler. Shake the inhaler well to make sure you get the correct amount of medicine evenly distributed when you do the puff. Remove the cover from your inhaler's mouthpiece, and if you're using a spacer, which you should, connect your inhaler to the flank end of the spacer, and that gets to your mouth. Exhale as much air from your lungs as you can, and put the mouthpiece in your mouth past your front teeth, and the rest, you must rest it in the top of your tongue. Do not block the mouthpiece opening with your tongue. Breathe in through your mouth and slow and steady state. As you do this, press the inhaler to release the puff of medicine. Finish breathing in slowly and deeply as you inhale the medicine. When the lungs are full, hold your breath as long as you can. If you can, 10 seconds. Then breathe out slowly through the puckered lips or through your nose. If you need to take more puffs, wait about 1 minute before doing the next puff. After you're done, rinse your mouth with water after you use the inhaler. This may keep you from getting a mouth infection or irritation. Now, this is more likely to happen when you use inhaled steroids as opposed to just ibuprofen, but it's always a good idea. Also, steroids are routinely used in the treatment of bronchitis. They help decrease the inflammation response that's going on in your lungs, and therefore reduce the mucus production in the airways. If you have bronchitis, do quit smoking. Do avoid smoky environments or secondhand smoke, but also avoid inhaling chemicals and irritants that are in the airways, like perfumes and chlorine and such. Do drink plenty of fluids. Do get plenty of rest, and do not overexert yourself. Do use a room humidifier with or damp towels around the room to increase the humidity of the room. Do wash your hands often to prevent the spread of infection. Do call your doctor if you become increasingly short of breath or if you cough with blood. And do call your doctor if the cough is lasting more than 3 weeks. Do not go out in the cold or in damp weather. And do not delay getting medical care if your symptoms worsen, if they don't improve, or if you get new symptoms. That's the end of the video. I hope you learned something about acute bronchitis, about the treatment, diagnosis, and how to use the inhaler properly. For other videos like this one, go to PatientEducation.Video. My name is Dr. Carlo Oger, board certified emergency physician. Take care.